Antibiotics will not take care of the damage, if any, has occurred, but it would only treat the infection, and if the treatment is successful, it can prevent further damage to the reproductive system. Hello guys, welcome back to my YouTube channel. Thank you to all my returning subscribers, and if you are new to my channel, please click on the subscribe button and turn on your notification. In today's video, I'll be sharing with us how pelvic inflammatory disease, commonly called PID, can affect fertility in women. PID is simply an inflammation of the reproductive system in women. A woman can get PID, that is pelvic inflammatory disease, when certain bacteria like Chlamydia, Trichomonas, Neisseria gonorrhea, which are sexually transmitted, travel from the vagina into the cervix and then into the fallopian, to the uterus, into the fallopian tubes, and sometimes to the ovaries. This can cause inflammation of the fallopian tubes, which can lead to scarring. And when this scar tissue occurs, it can block the fallopian tubes, making it almost impossible for sperm to meet with the eggs. And if left untreated for a very long time, it can cause permanent damage to the reproductive system. Sexually transmitted infections with chlamydia or gonorrhea are not the only possible causes of PID, although it is the most common. Douching with certain feminine products can push bacteria from the vagina up into the cervix and then into the uterus, causing infection. A woman can be asymptomatic, that is, showing no symptoms, or the symptoms can be so mild that it goes unnoticed. But as this infection progresses, the following symptoms can be seen. Number one, lower abdominal pain. The woman could have pains in the lower part of her abdomen. Secondly, she could develop fever, and then thirdly, she could have painful urination. She could also have foul smelling discharge from the vagina, pain during sex, and even bleeding during sex. And she could also have heavy, prolonged and very painful periods. Earlier PID is diagnosed and treated, the less likely it can cause infertility or other serious problems. First of all, is PID treatable? Yes, it is treatable, but like I said before, earlier diagnosis and treatment is very important, because the longer this infection stays in the woman's body, the more likely it is to cause more serious problems and more damage to the reproductive system. Antibiotics are the mainstay in the treatment of PID. It could be oral, that is taken by mouth, or intravenous, that is by injection, depending on the severity of the infection. Antibiotics will not take care of the damage, if any, has occurred, but it would only treat the infection, and if the treatment is successful, it can prevent further damage to the reproductive system. So how does PID cause infertility? Number one, PID causes blockage of the fallopian tubes. If just one tube is blocked and the other one is clear, depending on other fertility factors, one may be able to conceive. But if both tubes are affected, then conception may be extremely difficult, and the only solution would be surgical correction of the blocked fallopian tubes, or IVF. Secondly, PID also causes what we call hydrosalpinx. This is when the fallopian tubes dilates and gets filled with fluid. This swelling and blockage usually happens at the distal end of the fallopian tubes, making it impossible for the eggs to enter into the fallopian tubes, where it would normally be fertilized by the sperm. And this condition is corrected by a minimal invasive procedure called salpingostomy. But when fertility is not restored after this procedure, then IVF becomes necessary. Alright guys, that brings us to the end of this video today. If you found this video very useful, please like, share, and also subscribe. Okay, bye bye. See you in my next video.